So today, we're going to talk about resuscitation. But hey, this isn't some dry medical lecture. Not at all. It's really a story about innovation, empowerment, and how a simple sequence of actions, what we call the chain of survival, can literally bring someone back to life. Let's just kick things off with a true story. A young doctor is out skiing with friends, and she falls into a frozen stream. She gets trapped under the ice for 80 minutes. When they finally manage to pull her out, she has no pulse, no breath. She's clinically dead. And yet, after months of intense recovery, she went right back to work as a hospital doctor.
So you have to ask yourself, how is that even possible? How can a person survive for more than an hour with no pulse? Well, the answer is pretty incredible, and it lies in the science of resuscitation, a field that has completely rewritten the rules of life and death in just a few decades.
Okay, let's really get into this. When the heart stops pumping blood, that's called cardiopulmonary arrest. A clock starts ticking, and it starts ticking fast. The brain, all the vital organs, they're being starved of oxygen, and every single second is absolutely critical. For a very long time, that was it. There was nothing anyone could do. But then, a few key breakthroughs changed everything.
The whole modern era of this stuff really kicked off in the mid-20th century. First, doctors figured out that an electric shock could actually restart a heart, right through the chest wall. No surgery needed. Then came this other huge breakthrough, chest compressions, the idea that you could manually pump someone's heart for them. You combine that with rescue breathing, and boom, suddenly you've got the three core pieces of what we now call life support.
So, the most important word on this slide is reversible. Cardiopulmonary arrest isn't usually the end of a long illness. It's a sudden, unexpected electrical or mechanical problem with the heart. And it's a big if you can intervene quickly and do the right things, it can often be fixed.
Realizing that these techniques actually worked led to this really powerful new idea. See, it wasn't about just one single action. It was about a sequence of them, a series of links that, when you connect them one after another without any delay, they dramatically increase the chance of survival. And this became known as the chain of survival.
So you had these pioneers, like Dr. Cobb out in Seattle, who started training firefighters and paramedics. And as they looked at the data from real-life emergencies, two things just jumped off the page. It all came down to this. First, did anyone at all, start CPR right away? And second, how fast could they get a defibrillator to that person's side?
And the impact was just staggering. In places like Seattle, where they went all in on training the public in CPR and getting defibrillators to first responders, survival rates just shot up, in some cases as high as 40% on a massive scale. Now let's talk about the first, and you could argue, the most important link in that chain, the public. You. What a bystander does in those first few minutes is absolutely vital. You are the person who literally buys the brain precious time it needs to survive.
You know, the basic CPR cycle is designed to be simple for a reason. Those chest compressions, you're basically acting as a manual pump, forcing blood up to the brain to keep it alive. And the rescue breaths, they're providing the oxygen that the blood needs to carry. In essence, you are temporarily taking over the job of the heart and the lungs.
And the rhythm you're aiming for with those compressions is right around 100 per minute. You know, people always bring up the song Stayin' Alive, and for good reason. Its beat is almost the perfect tempo. It's fast and it's firm.
Now, the classic ratio that was taught for years was 15 compressions followed by 2 breaths. And yeah, the guidelines have been tweaked over time, but the core principle is exactly the same. A steady cycle of compressions, broken up by breaths, is the foundation of what a bystander can do.
But here's the thing about CPR. It's just buying time. It keeps the brain going, but it very rarely restarts the heart on its own. For that, you need the next link in the chain, defibrillation. And thankfully, a technological revolution made this power available to basically everyone. This right here shows the crucial shift. For years, only doctors and highly trained paramedics could use defibrillators because you had to know how to read these complex heart rhythms. But the invention of the automated external defibrillator, the AED, that was a total game changer. It's a smart machine, it analyzes the rhythm for you and then gives simple step-by-step instructions. And the results of just putting these AEDs out in public spaces, well, they speak for themselves. In Las Vegas casinos, security guards were achieving survival rates over 50%. On airplanes and in airports, places where an ambulance just can't get you quickly, trained flight attendants and airport staff have saved dozens and dozens of lives. That is what we call public access defibrillation, and it works.
This is so important because a common fear is, what if I hurt them? What if I do it wrong? And that's totally understandable, but listen to this. This is from the source material. The machine is designed to be foolproof. It will not let you deliver a shock unless it detects a very specific, shockable heart rhythm. You literally can't mess it up.
Okay, so let's bring all of this together. We've looked at the history, the science, the technology, but this entire system, this beautiful chain of survival, it all hinges on one thing: the actions of the very first person on the scene.
Sure, of course. Doctors have advanced protocols for things like severe hypothermia or cardiac arrest during pregnancy. But listen, none of that even matters if the first links in the chain are missing. It always, always, always comes back to early CPR and early defibrillation.
This chart really just says it all. I mean, look at these numbers. If an ambulance crew actually witnesses the arrest, the survival rate is about 50%. But when a bystander, or regular person, steps in with CPR and an AED, that rate is 40%. Just think about that for a second. You can give someone nearly the same chance of survival as a team of trained paramedics.
And so that leaves us with one final crucial thought. The system is in place. The technology is out there. The knowledge is accessible. The single most important and honestly the most unpredictable link in that whole chain is the person who sees it happen. And that person could be you. So the question is, what would you do?